Good afternoon again. Unfortunately, we are coming towards the end of a very fruitful day. Thank you again for all being with us and attending this summit. Now, the last panel for today is under the title of Recognizing the Role of Research for Evidence-Based Health Management. And for that, I would like to call the moderator of the panel, Mrs. Goshen Mohammed Qaradaghi. Please come up on stage. She is the Kurdistan Health Summit Scientific Board and a lecturer at the Department of Health Science at the American University of Iraq, Suleimani. Dr. Dawn Prisino, a medical doctor and global health expert holding academic appointments at Harvard University and London School of Hygiene and Tropical Medicine. Mr. Sirwan Mohammed Muhyiddin, Head of Survey Committee of Kurdistan Region. Dr. Kawa Salehi, Public Health Officer. Dr. Ahmed El-Shadhir, Assistant Director General of Planning Department at the Ministry of Health and the Director of the National Center for Drug Control and Research. Welcome all. You can start.
Thank you. Can we start?
Thank you. Yes, sure.
Okay, my microphone is working. Hello? Good evening, ladies and gentlemen. Thank you for your continued attendance today. I know that it's the last panel of the day, but hopefully it's one of the most significant ones, although I may be biased as a member of this panel. As our lovely presenter mentioned, my name is Goshan, and I will be moderating this panel that I think is going to be one of the cornerstones of what we aim to achieve out of this particular summit. It's to have a better understanding of our current health outcomes, but also to have evidence as a basis for our future decisions and strategizing mechanisms. I'm really honored to have the esteemed panelists on this stage with me, and hopefully this will be a discussion that will be worth the time that you will spend here listening to us. First and foremost, I want to ask a very simple question. It's a question to all on the panel. Why is data important when it comes to health management? Why do we need to rely on evidence? And that's open to anyone who wants to start the discussion. Can I please come to you, Don, first as a start?
Yes, very good. Thank you very much for the question, and I'm very happy with the invitation. I have been following all the discussions, and indeed it's very important. So as an editor-in-chief of two journals for Wiley and BMC, we look at data to inform policy and practice. That's it. To improve health of populations.
Thank you. Kak Sirwan, what do you have to say about the importance of data? Why do we need to rely on data when it comes to health management?
Yeah, well, data is knowledge, obviously. When you have to work on a program, a policy, design a strategy, you need to have data. It's not specifically related to health, it is related to other areas in the community, as we all know. So health in our region, as we know, is facing many challenges that we need to deal with. So definitely data for health in Kurdistan region need to be used, supported, and translated into policies and strategies.
Thank you. So we're getting the same answer here. So data is what we inform policy with.
Of course.
Is it just about policy? Dr. Kaur, do you think there are some other elements when it comes to data?
Data simply is data is information for action.
Information for action.
Yes, that is an important thing that we do know.
Absolutely.
Yes, simply you can say it is for action. If it is health policy or health, public health, other sides of the studies.
So to inform public health decisions. Thank you. Dr. Ahmed, do you have anything to add to what's already been said?
Yes, of course. Actually, the data is the raw material for researcher.
Absolutely.
And the research is very important to get the reality of things and make the decision for the decision maker is in the right position. So the data is very important, of course.
Thank you. So I guess we all in agreement that data is basically the cornerstone of which we rely on to make our informed decisions when it comes to management. Before we continue, can I just remind the panelists to speak as loudly and clearly as possible into the microphone so that our participants can hear well. We can all say we're in agreement that data is what we use to inform our decision-making process. This may be the most difficult question to answer for a number of reasons, but perhaps Don doesn't necessarily have much awareness of this, but for the remaining panelists, what's your assessment of our current situation in the KRG and also the wider Iraqi government when it comes to the use of evidence in our planning and strategizing when it comes to health?
Let me
Please.
shed some light on this.
Please.
Data usage in the community in Iraq and in Kurdistan region, from my experience as the president of Kurdistan Region Statistics Office, it's rarely used in making policies and strategies. It is there. We do have the data. We do have most of the data that is related to health, to education, a little bit of economy, population. All these data are available in the region, and the same in Iraq. However, I haven't seen a substantial effort from the related ministries to use these data to make their cases when they have their annual plan for budgeting, for improving the situation in health, for instance. So that's from my experience. Although we are publishing the data, we are holding public events, we try to market the data as much as we can. Maybe we are a little bit behind in marketing. We need to focus on marketing of the data in the region and in the rest of Iraq. But nevertheless, I think we still need to push the ministries and the related authorities to use the data.
Thank you. I come to you, Dr. Ahmed. From what we're hearing, we have data, we have the information, but we're not necessarily seeing it being used in the way that it can be. What do you say to this?
Actually, in our Ministry of Health, we have data mainly in geographical mapping. So we have a system for health management system. As you know, geographical health information system is a part of the health management system. So we already begin with this program, and we have good data collected geographically from our institute, not only in Iraq, but also in Kurdistan region. And these data, unfortunately, till now, we not use it as a data raw for researchers. So we hope in the coming time, we can use it, these data, and we can expand the program to collect another data from patient, from other parameter that is we need it in management health system, and we can use it as a data for researcher. Also, we have a technical challenge in a collection of these data. One of them, we need to make the sample representative for the intended purpose. Also, the second one, we need to achieve adequate statistical precision and to minimize bias of the data collection.
It is not digitalized data. It is maybe morely we say it is electronic, but when they have a form, they fill the form, they send the data, because there is no database really for that. Again, for example, the person that is the second level, also he enter the data, and they send it to us. We also enter the data again, so it's made too much other obstacles, like data management. It will be very difficult for you. Data management, data cleaning before that, data management. Sometime, if I wrote maybe I have even wrote something short notes on that, I can make some novel on it, writing. Why? Because I see something discrepancy in the data, unlogic data, too much. So as I supposed to analyze this data, but I work from the beginning to see the logistics. Apart from the data, when they send it, for example, the format of the variable are different formatting. Maybe they not fill there for such problem. For example, the date. We have different type when you formatting the date.
Yeah.
Some software not accept the other or accept the other type. When you want to make analysis of these data, you have different data. So for example, the 1st of February, it will be 2nd of January sometime. This is such things. Sometimes they are children, but they are male child, they are pregnant, you see. This is the problem with these such data. So it's very important. We see all the world, they are working on digitalization of data. Really, we are suffering there. Really, it is pain for me.
Right.
I worked before that. There is no my affiliation. I am public health officer. I'm working World Health Organization, Kurdistan. Same time, previously I was affiliated for Department of Health, Preventive Health in Dohuk, for example.
Right. And this has been a continuous experience in your career?
Yes, I work on that. The big suffer is when you enter data or when you deal with but we are suffering more when we see the data is of poor quality.
Right.
You know that there is variable, all of them, the answers or response is unknown. It's
So-
very difficult. Very
So
difficult.
to summarize then, would you say that some of the obstacles that you mentioned are not only poor quality, but also lack of digitalization of data, and so it makes it hard to manage
That is
the
the
raw
more,
data?
That is right. It is more
Thank
thing,
you.
It is more make this obstacle. We have data, but we don't use it in the
Right.
Sometimes you want to decide something. For example, do we give vaccine to the pregnant or no? We have no data. Although it is COVID is a new things, even vaccine is new things, but there is other data. We have mountain of data, really.
Yeah. So it seems to me then, from what you were saying and what Kaksirwan is saying, that we don't have a lack of data. We have the information there, but it's a matter of, first of all, sort of finessing the data, making it more easy to understand, and then also the actual implementation or use. Yes, go ahead, Don.
When it comes to data, it's actually the sophistication of the data.
Right.
And how you're going to use this sophisticated data. So in fairness with the government, there is definitely data because they are not doing things blindly.
Absolutely.
So there's maternal and child health data, there are health indicators, SDGs. There's data. However, the sophistication of it is where the question is. For example, at Harvard where I work, we work with governments and we look at the demand and supply for surgery.
Right.
So we look at the manpower of how many surgeons and infrastructure, and then we look at the demand so that when they meet together, we do a statistical analysis, we would know how many residency slots would there be, and in the long run, how many surgeons should we have for 50 years. So what I mean is we could have some basic data, which is good for some basic policy making.
Right.
But if you want your policies to be more sophisticated, where you can project for the next 50 years and how much budget you should put for that specific program, then you would need more sophisticated data.
Absolutely.
And the infrastructure of developing that data.
Absolutely, yes,
I do have
Kaksirwan.
a comment on both.
Please.
Yeah, well, I totally agree with Kakawa. We need to distinguish between two things now. One is the administrative data that is produced by the Ministry of Health.
Right.
The other one is the data that produced by my institution in using surveys and from the surveys that we collect the data. The data that we collect, Kakawa, they are all digitally entered. They are all based on valid statistical approaches that we use. We get the help from UNICEF, from WHO, from other organizations. And these data are mainly used and collected because of the lack of data in the Ministry of Health in those areas.
Right.
If we need to have a sustainable development and usage of data in the Ministry of Health, administrative data, administrative registers in the Ministry of Health need to be developed, organized, and used mostly by the Ministry of Health for the decision making. At that time, Kurdistan Regional Statistics Office will fill in the gaps. Now, they do have the data. They are suffering from data entry and inconsistency that they have in the data and the quality. However, in Kurdistan Regional Statistics Office, we do have the data with good quality presented, and they can be used for policy making and strategies and planning in the Ministry of Health. So there are two different things that we are dealing with.
Right. So would you say that unifying the actual method of collecting data or using data is a step towards challenging some of the obstacles that we've had then?
Definitely, yes, I agree.
Okay, thank you so much. Dr. Ahmed, I want to come to you and ask about if there are any other obstacles that you could think of besides the quality and the unison or the unification of data in terms of the use of data from an administrative level in government.
Yes, we have some obstacles, mainly, as I say, the collection of data. Who is responsible for the collection of data?
Absolutely.
The people who have the responsibility for the collection should be well trained and should have the knowledge of which data that we want exactly. Because some data we cannot use it, but they consume a time, consume a cost in collection, but finally we cannot use it.
Right.
So the type of data, the quality of data should be collected by well-trained person. As I say, the representative sample should represent the intended purpose, and the bias that as you know, our circumstances, like for example, financial, political, social, all these obstacles prevent the collection for the right data that we want to be used in the research.
That's an interesting point you raised. So then the question here is, who decides what data is needed? And then also, why do we have so much data based on your assessment that isn't necessarily useful then? Where is the mismatch here?
Yes.
Where can we find that mismatch?
It is according to what type of research that we want to do. It's for maybe, for example, for a certain disease, for a certain case, like for example for COVID, for the result of vaccination, how we can cover the vaccination of COVID-19.
Yes.
So it is depend on the type of what we want.
But I guess my question specifically is, who asks for that data? Who decides? For example, your institute, how do you know what particular surveys to actually implement to get the data that is required by the government agencies? Do you want to go ahead, Don?
Yes. So the data infrastructure is a societal initiative.
Yeah.
It's not only done by the ministry, it's even done by the academe, the research centers, think tanks, and so on.
Yeah.
So they are mostly the producers of data. For example, where do we get the information on HIV/AIDS of the country? We do not do a zero surveillance for all the population just to get the HIV. We have sentinel sites, and then we do a lot of inferential statistics, and then we get the prevalence of the country. And that is the same thing with the rest of the diseases.
Absolutely.
And that's not only done by the Ministry of Health, but the academe is a major producer of data because their role is to do research. Now, who are consuming the data? Society itself.
Right.
So whether it's the Ministry of Health, the policymakers, whether it's evidence-based policy making, and also, of course, let's just talk about your fashion. You're all fashionable here. Who determines the fashion in the next season? So there's someone that tells you that this is the trend,
Right.
and eventually everyone uses it.
Follows the trend,
Exactly,
absolutely.
and that is data. So data is something dynamic, unique, and everyone should produce it, and everyone normally would use it for whether personal decisions or societal decisions.
Thank you. But I guess just to get a sort of clearer answer for our audience members then, would we expect the fashion trends, so to speak, to be set by government or by academic institutes or by people themselves? Who are we looking to tell us what we should do for the next season necessarily?
That's a very good question. Talking about fashion, we're wearing blue, very fashionable. So Vogue magazine tells the population, this is the next fashion for the next season.
Yes.
So what they do is they collect all the information. No, let's not talk about fashion. Let's talk about influenza.
Okay.
So what vaccines do we use for next year? So we will look at the current prevalent H1N1 all over the world. We will get the top 3 variants, and that information will be provided to the pharma companies, and they will produce those vaccines for the rest of the world.
Right.
So we do that the year before, and then the production is done the year after.
This is from a global perspective.
That's a WHO protocol.
So would we expect then that WHO will tell us what data we need to have better management systems?
They have the protocols, but WHO should not be telling us what to do because we
Okay.
know better our health indicators.
Thank you. The reason I ask these questions is because I want to get clear answers so that we can actually use these to strategize in our coming sessions, because that is the purpose of this panel and this seminar. So thank you, that's really interesting. In such an instance then, I want to come back to maybe an earlier point I addressed, and I hope that you all can contribute to this. We have discussed the role of WHO, we've discussed the role of society in general, and also to some level government. Speaking as a faculty member from an institute, an education institute, what role does academia play, or perhaps the private sector play, in contributing to not only data itself, but also the actual use of data when it comes to management systems? That's open to anyone who wants to answer first.
Well, let me
Sure.
comment on that. So we do have data. I would say it's of good quality,
Yeah.
our data. And academia, to my experience, need to focus on the data that has been produced in the region for the last 10 years, for instance, to have a
Okay.
historical background. We do work with colleges of administration and finance, for instance. This college normally every year has graduates in statistics department. For the sake of easy collection of data, they go to all data that they already have in their books or database or somewhere else. Probably they should focus on the data that we have in the statistics office so that they can inform the public, the private sector, the government, that this is the situation for the last 10 years. This,
As an academic institute?
as an academic researching. They need to inform the public of the development of diseases, of pandemics, of anything that is related to health. Myself, I haven't seen such enthusiasm in the students that I have received in my office. For instance, we are having surveys every year for maybe 2 or 3 surveys related to health, like the multi-indicator cluster survey. It's a big survey that is supported by UNICEF in mostly 55 or 65 countries in the world. The data that comes out from this survey is huge. Is about child mortality, is about maternal mortality, it's about children health, maternal health. All these data are available from, probably Dr. Haja knows, from 2006 maybe, since we are, from 2006. Why hasn't been used for policy making?
That is the question.
We know that we have a decline in children mortality, but what is the reason for that? Should we continue in the policies that we are using in the Ministry of Health, in the primary health centers and in the secondary health centers? Is it because of good policies that we are using, or is it because of knowledge and education that households have gained through the years? So such researches need to be done in order to understand what is the situation.
So are you saying the role of academic institutes is to shed light on the data that is collected and then to give sort of an additional message to those who are in decision-making positions to make use of it? Is that a significant role that institutes should play? Yeah, go ahead, Don.
Yes, I'm an editor-in-chief of 2 journals with BMC and Wiley. And I am happy with some of the outputs of the local institutions here. They have been submitting a number of manuscripts.
Wonderful.
Unfortunately, I would reject, editor-in-chief is a powerful position. I would reject a number because of the quality of the papers. So I think one of the things that the academe should be focusing on will be the sophistication of the methods
Right.
of the way they acknowledge research as part of their role as a member of the academe. So that's one. In fact, I would, our gentleman here is defending that they have good data. If we can extrapolate that data towards policy making, for example, there will be diseases for diarrhea or let's say TB. We have the whole population demography.
Yes.
If it was evidence-based policy making, I would be able to look at the amount of money that we can put to eradicate
Towards,
tuberculosis because we'll just look at the pyramid,
Yes.
some of the samples of TB, and that's it. So that's evidence-based policy making. So therefore, the academe, who are the thinkers, should have that sophistication on using the data that is available.
Yeah.
Right.
And then I will be accepting all your papers for the journal
Well,
without publication fee.
You'll be bombarded, I'm sure, soon enough. Dr. Ahmed, do you have any contribution to this? Like, what's your view on the role of academia in terms of evidence-based health management? So, what's the role of institutions like universities and academics in the health management based on evidence?
Have the student for graduation, and
Yes.
they have to prepare a research.
Yes.
And this research should be applied for the health and for study the problem that facing the health system and to study the epidemiology of all things happened in the region. So it's very important because they have a good personal and prepared for the researcher, and they have to make the researcher in order to get the degree.
Right.
So we have to make this research in parallel with what the Ministry of Health need and what the health of the area need.
Thank you. Dr. Kal, I want to ask you a very specific question. From your experience as a public health specialist, do you think if we had the ideal situation where we had great data, great academic writing, and we had all of these reports and consolidated all of this information, is it received by our decision makers the way that we think it should be or not?
Yes. There should be a wellness.
Yes.
That's important, and the capacity for them. And we should fill this gap. It's like something like this gap between the academia and the policy makers.
Sure.
Also, we need policy analysts. Policy analysts also, we are needing them to fill this gap. So because the policy maker or decision makers, he needs some highlighted. We could not give them assignment like that. Just they need this, we say policy briefs. So they should know about the policy brief, then according to that they decide. Really, there is between the academia and, for example, Ministry of Health, there is a gap. And this gap, it should be filled. Not
How?
on ad hoc, should be a regular for that. There should be sharing with each others. Now, WHO, after the World Health Assembly, the regional committee approve or recognize the document that there should be strengthening the capacity of institutional capacity for events for policy, they say.
Right.
I have this resolution here. It is a good thing, and it is a new, because just their technical meeting, it was on last year in November. Maybe Dr. Ahmed, you was with them, I don't know. Because from the region, all the countries, there was a virtual meeting about therefore. They recognize the framework of this work because that it depends on the countries and the situation of them.
Sure.
Returning back to that, the other things, we will decide that surely the policy makers, the health managers, the public health managers, the academians, those who know their context of
Their country.
context, so the context and priority problems.
Sure.
Sometimes there is some health problem. Maybe it is a problem in Southeast Asia, but it is not goes with Kurdistan and Iraq. That's the priorities is very important.
Absolutely.
I am aware about what Doctor said here about the mixed surveys. Really, there is a good survey. I also, before 20 years, I was one of the team, yes, surveyor.
Thank you.
They have it. The Ministry of Health, they have this data, but need this connection, this gap. How we
Right.
can
So it's
fill
another
it.
obstacle. We don't have a connecting or a bridge between policymakers and the data
We can
collectors or
start
data
from here.
users.
If you see here, we have the research is in this summit. We have research is the first point.
Absolutely.
Also, another we should. Also, we are maybe at the evening we more that this
Yes.
evening, but it is good.
Thank
to
you.
Start.
Thank you, Dr. Kawa. Yes, go ahead, Don.
And that's the last cycle of research, which is disseminating the information
Right.
and translating it to policy.
Right.
So that's another important thing which we should not forget. But I think based on all the discussions that I have gotten from this summit, there is a problem with the infrastructure. I think it was highlighted during the first session,
Yep.
where the infrastructure should be there so that anytime we want to get the data, anyone can get it.
Yes.
And anyone who wants to make use of it, whether the problem with policymakers is that they are very busy,
Yes.
politicians. So therefore, we have a way of getting their staff members, and there are training programs for that. I think that's one thing that is also lacking.
I think I was going to sort of say, as a summary from what's being said already in the panel, it seems like the whole infrastructure of our data collection and data use is something that needs some sort of restructuring. We have issues with actual survey processes, with the quality of that data, with digitalization, and then also with presenting data in a way that policymakers who, as you say, are incredibly busy individuals, they don't want to be reading through pages and pages. They want the summarization of things that are important. We are coming close to the end of the time that we are allocated, so I want to end this panel by asking each of you, because we are a solution-oriented panel here, thank you. I suppose your final comments would be, for me, in general, which particular area should we focus on to improve this issue? And what would be the most feasible first step in achieving some sort of progress when it comes to encouraging evidence-based medical decision-making? Is that clear? Yeah? Who wants to go first with their ideas?
Wallahi, let me
Yeah,
start
please,
with-
go ahead.
Because of data collection is my responsibility,
Sure.
and dissemination is also my responsibility.
Sure.
The rest lies with you. You have to use the data. Funding
Okay.
for data collection is a big problem in our region. For the last 5 years, we depended on funds from the international organizations because of the economic crisis in the region,
Right.
and in Iraq as well. Defending our cause, our strategy to collect data with the Ministry of Finance is quite challenging.
Right.
It's quite, I would say, it's not impossible, but it's very, very difficult to convince them that we need to have data.
Right.
Funding is one thing that we need to work on in this region, and we also have to recognize that there are other areas that the government needs to focus on, like defense and other ministries. Finally, I would say the message is that without health and education, your community will not prosper.
Absolutely, thank you. So allowing that message to be given to everybody is a good thing to do, but also trying to find easier ways of getting funding for the process of collection of data. Thank you so much, Kak Sirwan. I'm going to come to Dr. Kawa next. What would be your suggestion for the next step?
Even sometimes we have limited fund,
Yeah.
but maybe it is not used in the right places.
Right.
And if it is used in the right places, for example, research or what you want to have, the result would not be adopted, or it does not be translated to evidence. So it remained there then, and we waste our resource, that limited resource. This is
Okay.
So I add something for that. We should make the spirit of research, that's right here, it should be in our culture.
Right.
We made this apart for willingness, the culture is very important. I mean the cultures for our context I am speaking. then building the capacities for that, and putting these everything in under institutions.
Right.
And these institutions, they should work with each other horizontally, not vertically.
Right.
This is very important for them, the development. We need the other side. And before that, advocating the importance of research among the health community, other parts, it is very important to reach our goal. Really, you have. Last thing I want to say, brain drain. Should not, brain drain,
Right.
it is very important. Maybe all the people, all we are have colleagues, like they are working in United States, in Europe, in
Right.
North America, and everything. So how we can, how we keep these people to be here, to remain here. Even
Right.
if he went abroad to study for everything, when he returned back, how can we use it? We should not make other thing with them. We should make them how strategies. The Gulf countries of the Gulf countries like Qatar, Emirat, Bahrain, they have their strategy to pulling back their brains like that. There is too much Kurdish doctors, Iraqi doctors, they are working in there.
Right.
So it is very important how we can make them to interested, how they make the same separate that he worked there with data, with research. We want the same thing to be here applied again and to invest in the young doctors, really. Maybe we are a little bit became aging or we go with our age, but we have young doctors. I saw them, I see them, especially the newly graduated doctors, the people are working, not only the doctors, we have other health professionals. We have
Right.
the nurse. I know nurses, they have university nurse, they made a research maybe better than the who is doctor, really.
Absolutely. Thank you. I mean, I was going to say that perhaps it's not necessarily about doctors, it's
Yes,
about
no, when I
professionals
say
who have-
health professional or health workers, any health
Absolutely.
workers. That's
Thank you so much, Dr. Kal. Your contributions are really interesting. So it's not just about advocacy and capacity building, but also trying to incentivize or encourage our very proficient individuals and professionals to stay in this country and do what's necessary for the progression of this particular field.
If you want, I want just add 1 minute
Sure.
about Reagan. From all the research that had been published in the last 10 years,
Yeah.
1.5% of them, they are from researchers from the Eastern Mediterranean region countries. We are very poor in that.
Yes.
Eastern Mediterranean country is 22 countries. We are sharing the global research. 17 countries out of them, they have just 20% of the Mediterranean that has been sharing with them. We have just
Right.
4 countries, they are good. But
Right.
we as Iraq and Kurdistan, we are within
not
the
doing so
17
well.
that our sharing is less than 4%.
Well, I mean, that's a very sad piece of news, unfortunately. But hopefully, as you say,
It means that the problem is not only here, in the region the whole, from Pakistan, Afghanistan till Morocco, except Algeria, it is not with our region.
absolutely.
Yes.
Perhaps then also another indication of trying to improve this would be by having an infrastructure that respects research. That may also encourage more research from not only government institutes but also external institutes also. Dr. Ahmed, I come to you. What would be your most feasible first step to try and achieve better evidence-based health decision making?
Yes, I think the application of the health management information system is very important
Right.
to be applied in each institute that's belong to the Ministry of Health.
Sure.
And we can begin with what I say. We already begin with the geographical information mapping, health information mapping, which is already applied, and we have a good information about each place of health institute belong to the Ministry of Health, not only in the Iraq but also in the Kurdistan region. And this system can be expanded to contain another parameter that's related to the health information management system. and this will provide a good data for the researcher, and rich data for the researcher can be used to be analyzed and to get a good result for the decision maker to take the right decision in distribution of healthcare and to
Right.
make the budget in the right position and so on.
Thank you. So essentially digitalizing our health data would make it significantly more easy for us to use the data for our decision making. Thank
Yes.
you. I'll come to you, Don, for the last, I suppose, say. What would be your most feasible first step towards achieving better health management through evidence-based concepts?
So we have to emphasize that one of the important blocks of the health system is health information.
Right.
So therefore, it's not negotiable. There should be very good health information within
Right.
a country or within a region. And based on the narratives that I've been hearing for the past 2 days, there are two priorities. One is really the infrastructure, which
Yeah.
has been emphasized by everyone, and a critical mass of researchers and
Sure.
information producers and users. And as for the number of publications, I have been discussing with the scientific committee that I would be happy to provide a platform with the journals that I manage, that some of the panel discussions here will be presented as papers to be
That's
published,
wonderful.
and probably the proceedings for this summit and the future summits, so that the whole world will be able to hear and listen and read about what we have been discussing. So
Well,
that's a
thank you.
promise for everyone.
That's really generous of you, and hopefully that will set a precedent for future publications in this region, because honestly we have very significant circumstances that are very contextually specific but also can be applied on a more general level, and it's a shame that we're not able to contribute as much as we should do on the global level. So thank you everyone on the panel. I think we've achieved quite significant and clear answers when it comes to the questions that I had addressed to you, and I appreciate your patience with me in my questions. At this point, I'm going to open the floor to questions, but before I do, I've been reminded twice to give you some announcements. The first one is that in a short while, so at 7 o'clock, we are going to be having our final session of the day, which is Health Voices, which is slightly different to the panels. These are a number of individuals who will be giving very short but very dynamic presentations on their contributions to health globally, and so hopefully it should be an inspirational thing to listen to. The session will be in these rooms where we'll remove the partition, so we'll have one collective room together again. We're going to be all together again, which is wonderful. The second piece of information is following that at 7:30 we have a social program at Al Bustan, which is the restaurant just outside of this hall. We will have live music and food for everyone to enjoy, so please do make sure that you don't run away straight after the Health Voices and come and join us so we can actually get to know each other better. Good, okay, now that that's been done, I open the floor to questions. So I have a number of questions from the floor. Wonderful to see some female names, and I am gender biased, so I'm going to ask Dr. Rojgad to give us our first question, if that's okay.
Thank you, Goshan, for the wonderful moderating the panel. Thank you, all gentlemen. So first of all, I'll start with Dr. Kawa. I truly agree with you that it's very, very, almost zero chance to get a qualified, reliable data in the governmental institutions. I remember that during my routine supervisory to one of the hospitals, all the babies born in that ward were only 2,500 grams, as if I was going to a bakery, and this precision in cutting the doughs is almost the chance is zero to have all these babies. So the thing is that the motive, why these people are collecting data, what's the importance of this data? So it's very hard to have a reliable data in the governmental. When you come to some data to use it, you will go to the surveys. Kaxirwan knows, which I was lucky to work with him in one of the major surveys, which to me should be used as a backbone of the health policy here. He knows that the data collectors will go through an extensive training on why this data is important and how to get this data. Data is either by a question and answer or sometimes measurement. So again, you talked about funding. It needs funding. It needs to be, it's not only the the salary to take it or not to take it. Someone should be responsible of this data. This girl, she was collecting the data, and without even analyzing or cleaning, she was sending it to me, and I have to send it to the Ministry of Health. So it's a chaos. To me, one of the bottleneck analysis will be focusing on these data collectors, not analyzers, because they are not analyzing anything, just to know why they are using these data and how they are using it. And thank you so much.
Thank you for that comment. So I'm guessing that's not a question, more a statement, yes? And thank you, I really appreciate that. So I'm going to come to Dr. Mohammed Hussein. Can we have Dr. Mohammed Hussein? Yes?
Well, good evening again. Thank you very much, Koshan. And I would like to thank all the panelists. One thing that I wished actually you have it on board within your panel, a representative from the Ministry of Higher Education, in particular to talk about research, as scientific research is a part of the Ministry of Higher Education. And I think I wish you had somebody on board from the ministry. Anyway, just to enrich what you have said actually, talking about the data, I think my colleague Dr. Roshgar just mentioned the reliability of the data which is going to be taken from the establishments in Kurdistan region. I doubted there is any difficulty with collecting data from the Ministry of Health for the researchers in the School of Medicine, as mostly all the members of teaching staff who are working for our medical schools in the region have been already seconded to the Ministry of Health, and they have an access to their data. I will ask that question to the representative of the Ministry of Health, if they are going to get use from the outcomes and the results of the researches which have been done by the members of teaching staff at the medical schools at the university. Just to remind you that probably getting the data from other establishments is not easy. I myself, based on my experience as a forensic linguist, I face difficulties to get the data from the courts, for example, because I'm not working in the court and I needed some data for my dissertation at the time, but I couldn't get it. But for the members of teaching staff at the College of Medicine, because they are already working at the Ministry of Health, this is easy. But the point is here, to which degree the Ministry of Health is going to take their results and outcomes into their consideration. As you know, research is going to be done for the things which are unknown. In particular, in healthcare sector, most of the researches actually are going to be done either to find which treatments work better for the patients or for diagnosis disease or to find solutions for the health problems. I hope that, I don't know how this works with the Ministry of Health. From our side, just a few years ago, we have announced a National Research Council at the Ministry of Higher Education, and we have secured a grant of over 2,050 million dinars for Iraqi dinars for our researchers for different sectors, among them health sector. For us, the priority actually is for doing the research, and we as I have heard from most of you, and in particular Goshan as a member of teaching staff was just reminding you of the role of the academics in doing the research. Right. At the Ministry of Higher Education, we totally encourage all the members of teaching staff at the ministry and the universities as well to do researches in different sectors, among them health sector. Thank you.
Thank you so much, Dr. Mohammed. So I'm assuming you have your question directed to our Ministry of Health representative. So Dr. Ahmed, would you like to take that answer?
Yeah, I don't have.
You don't have an answer? Does anyone have an answer for what Dr. Mohammed is saying? Can you just summarize your question? I think that maybe that would help. Just in one sentence.
Yeah, okay, in one sentence.
Yes,
to
please.
which degree, you, as the Ministry of Health, you get use from the outcomes and the results of researches done by the members of teaching staff at the college or schools of medicine?
Okay, so the question is, how, to what extent do the ministries actually make use of academic research, yes? Do you have an answer, Dr.
Unfortunately, till now, we don't have notable uses for this
Right.
data, for this research. Because the academic in Baghdad or the college in Baghdad, the researcher in Baghdad, have research not parallel with what we need, what the Ministry of Health need. They have another issue, another topics for research in academic, not used by Ministry of Health. We try to encourage them to make their research as a parallel what the Ministry of Health need. But
So
till
perhaps,
now,
so go on.
yes.
Sorry to interrupt. Please finish.
Till now, we didn't use this research that's done in the colleges, but in our Ministry of Health need, not meet the need of our ministry or our need. So maybe in the future we try to make it parallel with our need.
Thank you. I mean, that seems to be a question that addressed a problem, but also now we know a solution at least. Perhaps that's something that can be done to unify the aim of what the research is supposed to be. So if academia is creating research, it should coincide with the aims of the ministry so that they can be used. Yes? Thank you so much. I'm going to come back to Dr. Shara if you have a question for us, I believe.
Thank you very much, everyone. Since the aim of the whole summit is to produce a plan of action, so I have a question that I directed to Dr. Ahmed and Dr. Dawn. So we know that medical record number is something that we can use in the USA, where we can have that number and have all the data of that patient, like the history and everything. So first of all, the Ministry of Health, do they have a plan to allocate budget as early as tomorrow? And then train the individual. We need to have a plan, a timeline, and things with very specifically structured. So starting with training. Training is one of the most important things, as Dr. Rojgar said, training of those people who collect the data, and then allocate a fund for IT people, and then start to plan ahead of time. It could be on the base of individual institution database, and then it can be centralized to the Ministry of Health, and then I think this is something that needs to be started as soon as possible. So my question for Dawn, how difficult do you think would that be possible, and what would be the timeline if you want to implement such a system or database in Kurdistan?
Oh, it will take some time if you want to make it more sophisticated. So infrastructure is not very easy. You have information technology, digitalization, harmonization of data, and that takes, and information technology is only good for 5 years. After 5 years, you change the system again, because it's like your laptop. After a few years, you have to change it because it's not functioning anymore. So that's the same thing whether it's disaster management system, so on and so forth. So as long as there's enough budget and the government is really willing to put money on that, then it will be faster. Because data infrastructure, once you have the infrastructure, it doesn't mean that that's it. We have to keep on updating and updating it. And when new technologies come in, you have to tweak the data that it will be usable for future programs. So that's why we have to be very fast also with the use of information technology. And that needs money.
Yeah. So Dr. Ahmed, any budget for that?
Yes, we already began with the health information system in our Ministry of Health, but because of the COVID, pandemic COVID, we maybe 1 year we delay in the applying this program. But now we begin with the second step by activation of this system. And as I say, we begin with the geographical health mapping, and we success. And we will try to expand to another parameter that's related to the health management information system.
Thank you so much. Thank you for that wonderful question or questions. We have time for one more question from the audience, and we have, do you have something to say, John?
Yes, I just want to make a provocative comment.
Please, go
because we
ahead.
have been discussing
We
the
live
role
for
of the
provocation.
academe and the role of the government. They are different. The role of the academe, Oxford University was not sued, but they were complained that their role is to produce the research. The role of the government is to make changes within the society. Therefore, they might work together, but they have different objectives.
Right.
So the role of the academe is to produce research, to advance science, but not necessarily to do the implementation of programs to change the society, which you might not like this kind of paradigm. On the other hand, the role of the government is to move things, do changes, implement programs so that the society will develop. They are a bit different. Therefore, the use of data and the production of data are totally different.
Thank you. That's a really good clarification. So we come to our last question. We only have about a few minutes left, so I would really ask you to keep it short if you can. Dr. Mohammed Saeed, if that's, am I right?
Thank you very much for this panel discussions. My question is that we can use the data not only for research, for quality improvement, and that quality improvement can be, the impact of it will be seen very shortly. I will give you an examples. In Najaf, we did auditing to the thromboprophylaxis for pregnant ladies, and we collect the files and we study the files, and we see how much those ladies has score for thromboprophylaxis. And at the end, we have few numbers, very little numbers, and on that we found that 93% of the women, they are not scored. There is no score, and they use abortions as a reason to give thromboprophylaxis. And actually, abortion is not mentioned in the score. And there are many things that when we correct them, the achievement on the ground, and the nurses was trained to do the score by themselves before the doctor, then definitely there's a lot of women who were receiving thromboprophylaxis. Now they are not using because they don't deserve that, and a lot of women, they are not neglected because they are not screened. Then, so I think we can use the simple data, even if they are not totally correct. You can use them and you can make the care much more safer and much more better. And this is what is audit. This is the research of my trainee, his internal medicine board, Iraqi Board of Internal Medicine, and the results are seen on the ground. And thank you very much.
Thank you. That's a very hopeful message, that even though we may not have the best system, we can still make use of it to have improvements. Thank you so much. I want to thank everyone from the audience and your wonderful questions. But also I want to thank every one of my colleagues here, the dear panelists, for a very insightful and very important discussion. I thank you again for your contributions. I thank you all for your continued attendance, even though it's the last panel of the day. I thank you for being here. Before I let you go, just another reminder, we have Health Voices at 7 o'clock in this room. So please stick around for that. Otherwise, we'll be having our social gathering at 7:30 in Al-Bustan, if I'm not wrong. Yes, yeah. Al-Bustan. All that's left to say is hopefully with the contributions of our dear panelists and also your presence here, we can now give at least some answers towards the question of the panel that was in question. Again, thank you for your attention. Have a wonderful evening, and I shall see you all around. Thank you, dear panelists. Okay.
Thank you so much, dear panelists. We have come to the end of this fruitful day. I would like to thank everyone who joined us today. Again, upcoming Nest is an event under the name of Health Voice, where 2 Kurdish doctors will talk about their success stories. So we kindly ask you to join us after a 30-minute break. After that, we will all head to Al-Bustan restaurant here in Ratana for good food and live music. Thank you, everyone. Thanks for coming.